We told you earlier that Pfizer's vaccine trial showed promising results for children under 12. The company announced today early results indicate their shots are safe and effective for kids aged 5 through 11. The trial was also conducted using a smaller vaccine dosage. For more on this, let's bring in Dr. Michael Osterholm. He's an American epidemiologist and a Regents professor and director for the Center for Infectious Disease Research and Policy at the University of Minnesota. Dr. Osterholm, always great to see you. Thank you so much for joining us.
Thank you. Good to be back.
So let's talk about the antibody response. Did children show any antibody response in this trial, and how did researchers, or how were they able to determine the correct dosage?
Well, we have a lot of experience with looking at dosages and vaccines between adults and kids. And so, of course, the same logic was applied here in terms of the research. Once we showed that they were safe and effective in adults, and then older kids, 12 and older, basically what's called De-Escalation Studies, or basically just reaching down further in age. And so with this particular study, approximately 1/3 of the dose that we'd seen in an adult was used in the child. The children that participated showed very good antibody responses, overall immune response, and then they, in addition, had a very good safety profile. So this is what we expected. It was not an unexpected finding. It's good news. We want to get vaccines to these kids as soon as possible.
We've seen a big jump in pediatric COVID cases recently. They account for nearly 30% of COVID infections in the United States in the last few weeks. We know that here in New York City, there's a school that has gone back to distance learning because several staff members tested positive for COVID. But those were adults. What's your concern now that kids are back in school?
Well, one of the things we have to understand is that the data that we first generated on the risk of children transmitting the virus, getting infected themselves, and having serious illness largely occurred with the period before Delta was present. This particular variant has really changed the game completely. So the data that said that you could put kids together in a schoolroom and not have lots of transmission just don't hold today. There have been over 1,800 schools in the United States just since school has started that have been closed due to actually Delta virus transmission. If you look at the number of deaths in kids over the past year, over 24% of those deaths have occurred just in the last month. And this is really a reflection that this is a different virus, and unfortunately far too many of our schools are opening up in ways that put these kids at, and the staff members at increased risk for becoming infected. And we can't count on the fact that this virus won't be transmitted in a very difficult way in these schools. It's actually being transmitted very, very dynamically right now.
And Dr. Osterholm, I mean, the fact that Delta is surging and, is affecting so much of our lives now, when going back to the earlier part of this year, in early spring, we thought we were sort of seeing the light at the end of the tunnel. And certainly people are going to be angry if measures are implemented by governments and local municipalities to ensure that the spread of the Delta variant does not continue. But my question is, we are where we are today because of the fact that we have less than 60% of all Americans fully vaccinated, and that there are people that still resist wearing masks. There are still people who resist some of the measures that the CDC has recommended. Is that your understanding?
It's exactly it. I mean, think about this. We have over 70 million Americans right now that could be vaccinated and are not vaccinated. That is more than enough human wood for this coronavirus forest fire to burn. And we are going to continue to see challenges with this virus around the country. In addition to that, now that we see with Delta variant this very dynamic transmission in kids, they don't have access, particularly for those under 12 years of age, the access to vaccine. And so we have to try to protect them by vaccinating our adults in the families, older kids, by vaccinating people in the community. Right now, it's really, I think, a shame that only about 50% of kids who are 12 years of age and older who could be vaccinated are. So don't be surprised when we see these outbreaks in high schools and junior highs that are occurring. And of course, even then, think about the fact that when your 14-year-old gets infected, when they could be vaccinated, and come home and transmit it to the 10-year-old and the 8-year-old and the 6-year-old, these are really, really unfortunate situations. So vaccination, vaccination, vaccination is the key right now, and we're not availing ourselves to that tool because of all the politics, all the disinformation, and that's costing lives.
One of the things that I've seen, Doctor, is, there have been some, so we've talked about the idea that in certain school districts in this country, you need vaccines for diphtheria and tetanus, polio, measles, mumps, rubella, hepatitis B, chickenpox. Those are, in some school districts, those are mandated vaccines. And I've heard people who are not doctors suggest that, well, we know those diseases really, really well, or we understand them really, really well, and that polio is much more deadly than coronavirus. And I just think to myself, but you're not a doctor. We have no idea as of this point. I mean, we know that the coronavirus is deadly, but as the virus continues to mutate, I struggle to understand why people are totally fine with those other vaccines being mandated, but are not fine with this one.
This is a challenge that all of us are confronting. I mean, the facts are 1 out of every 500 Americans has died from COVID virus infection in the last 18 to 20 months. This will soon, in terms of number of deaths, surpass the worst catastrophe we've had in this country ever in our history, which was the 1918 influenza pandemic. The fact of the matter is that this is killing kids right now at a rate much, much, much higher than our worst severe influenza years. The fact is that the data are there and they're compelling, that we have a very bad situation on our hands, that we have a tool that is very effective and that can be used. And, trying to cut through disinformation, I'm sorry for those who died from this virus, who have been the anti-vacciners out there. Every week, I'm learning of more and more individuals. Very recently, an individual here in the upper Midwest, a 49-year-old male who was a very major anti-vacciner, basically died, left 4 kids behind. How many more tragic stories like this do we have to have before people understand that this is your get-out-of-jail card? This is what will protect you from serious illness and hospitalization and deaths. And so I think we just have to keep hammering that home. And as I've said many, many times, if you think you can run out the clock on this virus, you can't. It will find you. And eventually, if you're not vaccinated, you will get infected. And if you get infected, you surely have a chance of becoming seriously ill in an intensive care unit and dying. Why take that chance? Get vaccinated.
And before I ask you a question about Minnesota, where you are, Doctor, just one quick question about previous vaccines. I don't know if you were of age when polio vaccines were first introduced in this country. And
I was.
You were. So my question was going to be, do you recall your parents or anyone in your family suggesting that they don't want you and other children to receive the polio vaccine? Was there any kind of permission slip from the school to your parents? I'm just trying to understand the climate at the time when they lined you up and gave you a sugar cube with what you had to trust was something that would save your life.
It was actually even, in a sense, different than that. And what I mean by that is that it was like Christmas all over again in September when we got our first doses of polio vaccine. It was a celebration because now we could avoid this terrible paralytic disease. And parents could not wait for their children to get vaccinated. So we've come a long, long ways, unfortunately, in the wrong direction since that time. And now we have all of this mis or disinformation. And, you can say, well, let me make the decision for myself. But you know what? That's not the case. You're making a decision for a lot of people, because if you don't get vaccinated and you get infected, you are transmitting the virus to others. You are using healthcare resources that are now preventing people who have heart attacks, people who are injured in accidents, from getting the immediate and appropriate care that they need because our healthcare systems are so overwhelmed. So your behavior does impact others. It's not just about you. We don't let drunk people drive on the road just because they say it's my right to. We take them off. We charge them. And basically at this point, if you are unvaccinated, literally putting others at risk because of your behavior.
Doctor, I mentioned Minnesota, which is now in its fourth wave. How has the Delta variant made this wave different from the three previous?
Well, you know, what we're seeing around the country is this what I would call migrating surge. It started out in the southern Sunbelt states. It surely peaked there several weeks ago, is coming down. Then we saw it more in the southeast, where it appears to have peaked and now is starting to come down. But we're now watching it basically migrate up the East Coast. We're starting to see mid-Atlantic states now with more activity, even states in the Northeast. We're seeing that in the West. Originally, it was in Oregon and Washington where we saw the highest number of cases. Now that's moved eastward. And that's what's happening in the upper Midwest. Right now, we're seeing this increasing number of cases. We're seeing them clearly in the unvaccinated population. And we're seeing many younger cases, meaning younger adults, 20, 30, and 40, who are intensive care units, who are critically ill with no underlying health problems beforehand. They thought they could run out the clock on this virus. They can't. So I think what we're going to see in this country is this continued migrating surge that's occurring, that's keeping these numbers high. Today we had over 2,000 deaths reported in this country. I mean, we're getting to the point of where we're starting to approach what we saw in the winter surge last year. So this is really a challenge that is not going away. And here in Minnesota, we're deep in the middle of this next surge right now.
It's troubling words there from Dr. Michael Osterholm. Doctor, thank you as always. We appreciate it.
Thank you.